So, doctor, what is the difference between inflammatory bowel syndrome and irritable bowel syndrome?
Inflammatory bowel disease is basically a pathological problem where you can see the ulcerations in the large intestine and small intestine sometimes. And whereas in IBS, it is just a functional disorder where you don't have any ulcers in the irritable bowel syndrome. So the symptoms also vary in both. So both may have diarrhea, but the bleeding, presence of bleeding is a sign which is contradicting the diagnosis of IBS, means irritable bowel syndrome. So if one have bleeding and pain, one should suspect of inflammatory bowel disease rather than irritable bowel syndrome. So these are the two important distinguishing diagnoses, distinguishing features which will rule out the IBS.
So the minute a person has bloody stools, as in they are detecting or they are thinking it's IBS, but they have bloody stools, then it is mostly it is IBD and not IBS.
Correct. And also they'll have some weight loss also, loss, malnutrition features, because there's absorption problems in the intestine.
That's also a very interesting point.